Morphine sulfate Er is used to help relieve severe ongoing pain, such as pain due to cancer. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. The higher strengths of this drug, 100 milligrams per capsule and higher, should only be used if you have been regularly taking moderate to large amounts of an opioid pain medication. Using these strengths without a regular opioid tolerance may cause overdose or even death. It's important not to use the sustained action form of morphine to relieve mild pain or pain that will go away in a few days. This medication is not for occasional, as needed, use. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. Before starting to take morphine sulfate Er, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take this medication on a regular schedule as directed by your doctor, usually once or twice daily. It can be taken with or without food, but if you experience nausea, taking it with food may help. Swallow the capsules whole, but if you have trouble swallowing, you can open the capsule and sprinkle its contents on a spoonful of soft, cool applesauce. Do not chew the mixture. The dosage of morphine sulfate Er is based on your medical condition and response to treatment, so do not increase your dose or take it more often than prescribed. If you are giving this medication through a gastric tube, ask your healthcare professional for detailed instructions. Before starting this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Other pain relievers may also be prescribed, so make sure to consult your doctor or pharmacist about using morphine safely with other drugs. Suddenly stopping this medication may cause withdrawal, so your doctor may lower your dose slowly to prevent withdrawal symptoms. If you have any withdrawal symptoms, tell your doctor or pharmacist right away. Finally, tell your doctor if your pain does not improve or if it gets worse, and take this medication exactly as prescribed to lower the risk of addiction. Some common side effects of morphine sulfate Er include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These side effects may decrease over time. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so ask your pharmacist which type is right for you. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. However, you should tell your doctor right away if you experience any serious side effects, such as interrupted breathing during sleep, sleep apnea, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of your adrenal glands not working well. If you experience fainting, seizure, slow/shallow breathing, severe drowsiness/difficulty waking up, or signs of a serious allergic reaction, such as rash, itching/swelling, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. Morphine sulfate Er is a medication that is used to help relieve severe ongoing pain. It belongs to a class of drugs known as opioid, narcotic, analgesics. It works in the brain to change how your body feels and responds to pain. Morphine has a risk for abuse and addiction, so it's important to take it exactly as prescribed by your doctor. Your doctor will start you on the lowest dose possible and only for the shortest time needed. It's also important to avoid taking alcohol or other drugs that can cause drowsiness or breathing problems while using morphine. If you experience any serious side effects such as slow or shallow breathing, severe drowsiness or dizziness, or difficulty waking up, seek medical help immediately. It's also essential to keep this medication in a safe place to prevent misuse or abuse and to seek medical help immediately if someone accidentally swallows the drug. Women who are pregnant or planning to become pregnant should talk to their doctor about the risks and benefits of using morphine. It may slightly increase the risk of birth defects if used during the first 2 months of pregnancy, and using it for a long time or in high doses near the expected delivery date may harm the unborn baby. If used for a long time, babies born to mothers using this drug may develop severe withdrawal symptoms, so it's important to seek medical help if you notice any symptoms in your newborn baby. Before taking morphine sulfate Er, make sure to talk to your doctor or pharmacist about any allergies you may have to opioids or other medications. It's important to discuss any medical history you may have, especially if you have brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while taking it, and to be cautious when driving or operating machinery. If you are an older adult, you may be more sensitive to the side effects of this medication. It's important to talk to your doctor before using this medication during pregnancy or while breastfeeding, to discuss the potential risks and benefits. It's important to be aware of the potential interactions that morphine sulfate Er may have with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain pain medications, naltrexone, and samidorphan. The risk of serious side effects may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. Tell your doctor or pharmacist if you are taking other products such as other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Also, be sure to check the labels on all your medicines because they may contain ingredients that cause drowsiness. This medication may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. Always consult your doctor or pharmacist if you have any concerns about potential drug interactions. If someone has overdosed and is experiencing severe symptoms like fainting or difficulty breathing, naloxone should be administered if available, followed by a call to 911. If the person is awake and not showing any symptoms, it's important to contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. Symptoms of overdose may include slow or shallow breathing, slow heartbeat, and coma. It's important to remember that morphine sulfate Er is prescribed for your specific condition. It's not meant to be shared with others or used for a different condition without your doctor's guidance. If your doctor recommends a different medication for another condition, be sure to follow their advice. If you forget to take a dose of morphine sulfate Er, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take extra to make up for it. Take your next dose at the regular time. When it comes to storing morphine sulfate Er, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a safe place, away from the reach of children and pets. It's also crucial not to flush this medication down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, it should be properly discarded. For more details on how to do this, you can read the medication guide or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.